Hello, I'm Tricia Brown and an occupational therapist and certified lymphedema therapist with Upland Hills Health Skilled Nursing and Outpatient Facility.
And I'm Ashley Miess. I'm the occupational therapist with Upland Hills Home Health, and I'm also a certified lymphedema therapist. Today we're here to talk to you about edema, which is the medical term for swelling. In general, we define edema as your body's natural response to an injury or inflammation. Simply put, your body sends more blood and nutrients to that area of the body which is affected in an effort to help heal the injured tissue. You will see edema in the area where the injury occurs, such as a bruise or a cut or a joint. There are a few different types of edema. The one I just got done talking about was acute edema. And there's also what we call chronic edema, which is more long-term type. And the mechanism is a little bit different than acute. Typically you will see a blockage in the circulatory or lymphatic system. Typically associated with a chronic edema, you'll see conditions such as kidney disease, heart disease, liver or lung conditions, or circulatory impairments. It could also be the result of a more acute type of edema that has not been properly healed or treated. This type of edema is a little bit more widespread. It affects an entire arm or limb, more commonly your legs or feet, but it could also affect any part of your body, even your face or your abdomen. And as there are different types of edema, there's also different ways of treating edema, which Tricia will talk to you about.
Ways to help treat acute edema can be associated with the acronym RICE: rest, ice, compression, and elevation. Other common causes of acute edema can be post-surgery, increased salt intake, standing or sitting for prolonged periods, medications, and even pregnancy. Regardless of your medical condition or your symptoms, you want to contact your doctor immediately if you have sudden changes or unexplained changes in edema. Edema that becomes red or pink, or if it's painful and tender or warm to the touch. Shortness of breath and chest pain can be associated with edema. Like stated previously, chronic edema can be in different conditions such as cardiovascular disease, kidney disease, liver disease, different types of cancers, and post-node removal. Swelling that can last a long time is harder to treat. Signs that you would want to consider with chronic edema would be considered pitting edema, which is when you push into your skin, there's an indentation or dimple that lasts usually between 1 to 3 seconds. Also tight or shiny skin or textured skin, and then there's a very different condition called brawny skin, which is when the swelling no longer pits because of damage and fibrosis of the underlying tissues, giving your skin an appearance like an orange peel.
There's a lot of different things you can do to manage your edema. Be sure to talk to your doctor about the different possible treatment options. Some of those options include exercise, compression, elevation, keeping your skin moisturized and protected, and possibly even reducing salt intake. But be sure to talk to your doctor about any of these options first. If you continue to have any questions, consider asking your doctor about getting a referral to a skilled occupational or physical therapist who is knowledgeable in how to treat edema. They can give you a more individualized treatment plan.
We hope this was very helpful or informational for you.
Thanks for joining us.